Hello, anybody who's watching this. So I promised a couple of people I would do a thread lifting video. So that is what I'm doing. I tried to record doing this and my phone ate it. So I will be showing you how to do one next to it. What my purpose here is putting them in this area is that as you age, you tend to get a pre-jowl. And what that is several things. You get bone loss, you get fat loss, you get laxity, or maybe you've gained some weight and so that jowl is starting to hang a little bit. With me, I've been losing some weight. I have an autoimmune illness and so my weight fluctuates wildly at times. I ended up losing a bunch of weight and I'm still losing it. But I'm at the stage now where I think I can tell what's going on in this area. I've used some fat dissolver here. The reason I did that is because I know the anatomy. I know what area not to hit. This is not exactly a safe area to do it in, but you need to educate yourself if you're going to do so. So I've gotten to the place where I want to be. I did some fat dissolver under here as well. So now it's time to tighten things up and add some collagen. So, oops, excuse me. Why I'm putting it here is because as you can see, there's a bit of a dip in this area. One thing you can do is add filler, but I prefer not to because it's not a permanent solution. You're gonna have to keep replacing it. I don't like using fillers unless I absolutely need to. You know what I mean? I'm vain, what am I gonna say? So putting these twist threads in here will help to tighten up the skin. It'll help to add volume and add that line that we all want. You know, nice snatched jawline. So that's what we're trying to do here. I've already placed like 3 in a ladder formation here. I've also placed a couple in here as well. I'm going to do that on the other side too. But I wanted to show you just kind of what this looks like. I'll put in another one so you can see. So I'm twisting and removing. Okay. Now the reason I keep these in, and you'll see a lot of people do that, it's not necessarily just for show. It's also because when you leave in, hold on, I'm looking for my cap here. When you leave in the thread, if you happen to hit a nerve, no, oh my God, happen to hit a vein and you get some bleeding, you leave it in there, it allows it to have hemostasis, which basically means it'll allow the blood to clot a little bit before you pull it out so you don't get bruising. You know, no bleeding, no bruising. So you can kind of stop that in its tracks by leaving it in there, letting the hemostasis start to happen. All right, so what I'm trying to do here is like do these while looking into the phone, which is not always the easiest thing, and this is just not any better. Plus my glasses are filthy. Okay, since my glasses are filthy, and I just touched them, I'm gonna put a little alcohol on even on my gloves, just to be careful. All right, so being sanitary is extremely important for obvious reasons. Now, I just lost my thread. Here's my thread. Yes, so these are twist threads. Of course, now my hands are too wet. And I'll show you what they look like. Right, so a twist thread is basically a single PDO thread wrapped around the needle. I don't think it wants to show you. Not that that would help, it's the same damn color. All right, you know what? I really suck at this whole like phone focusing thing. And tiny little fucking needles. Oh, there we go, that might be better. Sorry. This is a single thread wrapped around the needle. The point of that is it causes more collagen production and gives you a little bit more volume. So in areas where you want to kind of plump things up a little bit, this is the kind of thread that you would use. Now, okay, we're going to go back in this direction. So you will know you're in the right plane with these. These are, you know, you're going in the upper levels of the dermis. I can't speak. Upper levels of the dermis in order to get that collagen production. So you kind of like poke it in at around a 30-degree angle, level it out so it's straight, and then you will know you're in the right plane because it'll be easy. It will slip in so easy. If you're in the wrong plane, you're gonna get either pain or resistance, and you don't wanna mess with that. You wanna stop what you're doing, and pull back out at that point. You can always place another thread if you happen to like ding a little nerve or a vessel, or you know, the pain is usually because you're hitting a nerve and that's not good. And there's quite a bit of nerves happening in this area, especially under your jaw. So you want to be very, very careful about that. So I want it to end about here because I want it to go into that dip. I'm going to do it right about here, I guess. So you measure it like that. Twist the bevel. There we go. So you know you're in the right plane, it just kind of slides on in. Great. Leave it in. Now, so I'm going to be placing several threads like this. So I'm going this way, so I'm going that way, like I said. And then I'm going to let it do its thing. Usually in about, oh, I don't know, usually around like 12 weeks or so, you're gonna start to notice the change. I mean, you'll have some immediate plumping because these are twists. When I do my lips, for instance, the day I do it, it'll be super plump and juicy looking and really pretty. And then after about a week, it'll kind of start to settle down a little bit and like the volume looks slightly less. But then you wait about 12 weeks or so as it starts to produce the collagen, they'll kind of magically plump back up again, which is what happened with my lips. So you gotta be patient. It's a long game. This is not fillers. This is for long-term production. I should be staring at the camera. Anyway, I'm looking at myself. And it's much better for you, just in terms of, you know, it's a natural process that you're instigating. You are going to eventually build up some decent volume here if the more you place the threads. And especially using these twist threads. Tornado threads are really good for that too. Tornadoes are like maybe 2 or 3 threads wrapped around at the needle, and that is for super volume, which is really nice. I just don't have any right now. I happen to have like 40 threads, 40 twist threads I need to use. So, so there you go. Letting this sit a little bit. I'm also going to go back in this area here and go just through that little, like what I am perceiving as a little pocket of fat, because it'll subsize it and tighten it up. Because really it's not so much that it's fat, it's that it's a little bit of skin laxity, right? So I'm gonna be adding quite a few threads here to help punch up the volume. I'm gonna pull it out now because I'm talking and it's moving. There we go. See, and it's gone. So punching up the volume in that one area is my goal for just right in these little dips. And then back in through here, I'll place also some threads just because that's going to cause some tightening. And it'll all end up matching up in the end, believe me. Because with PDO threads, they cause collagen and elastin production. So you are going to get tightening in the area where you're seeing some laxity. And that is kind of what you want when you're starting to see some signs of aging. Okay. And as you can see, my jaw is angled fairly well. I have placed threads all in through here before. Like I said, it's a slow game. You will see a bit of instant results, and then you're gonna have to just kind of wait and let things settle. While I'm actually in like the active process of trying to build collagen and trying to build volume, I will go a couple of weeks between placements because you want to allow you want the collagen production to start working, but you also want to see what you need. Like, is one round of threads in here enough? If you feel like in a couple of weeks that you maybe need a little bit more plumpness or a little bit more definition or more collagen production in this area, you can always add a few more. Well, I would say, you know, one here, but, you know, give it a little while. So the first placement of threads has some time to settle and produce collagen. So I recently lost some weight. I am still losing weight. And so skin laxity is obviously going to be an issue. Not so much fat, but like just the laxity. And also you get bone loss in this area, you get fat loss in this area, and it starts to show right in through here. And so if I can build up the volume in this area, you know, hopefully I won't have to resort to fillers at any point, because it's not really all that bad yet. I am 51. I forget if I mentioned that yet. So, you know, fat loss, collagen loss, elastin loss, it's all a thing. I'd like to show you doing my lips, and I think I can probably do that. But let me place a couple more in through here, and then we'll do lips. Okay, so as I said, I really prefer these days to be doing the threads as opposed to fillers and such, because, I mean, I'm very careful. I know my anatomy. I know that anything containing hyaluronic acid is it can potentially cause a vascular occlusion. You can get lumping, you can get, like, migration is a huge thing, especially if you're older. You're gonna have filler migration much more, there's much more of a chance of it if you are older and your skin is more lax. There's not enough framework around there to help it. So what I like to do is build up as much as I possibly can with threads. And then after that, if I really need to go in with something, with some fillers, which you really probably don't need to do, if you're doing this regularly, then you can kind of like augment it with a little bit of filler. But you really need to know your anatomy. You need to know what you're doing. You need to know the depth of injection. Even if you're doing mesotherapy, like under the eyes or whatever, if you're using anything with cross-linked hyaluronic acid, you know, I happen to have really shallow vasculature up and through here. So no matter what I do, even if I'm at like a super shallow depth, like maybe 3 to 4 millimeters, I could easily occlude up in this area. You just don't want to take that risk. You know, you need to know your anatomy, you need to know what to avoid, which I do, but I just happen to prefer doing this because it's ultimately going to give you a better result in the long run. Of course, the younger you start this, the better. I'm not saying like necessarily 20, but when you start losing collagen, which is around 27 to 30, that's when it really starts to happen. So this is kind of a way to do preventative and also just build up what you've got, change the way things look, puff things up a bit here, which we want to do. So I think I'm going to add one more right in through here. Yeah, that looks about right to me. So we're going bevel up again. Get us that first layer. I'm going to feel a little slight bit of resistance as you go through those first layers is natural. There we go. Once you get in the right plane, it'll slide in easy. Turn the bevel so you don't keep going deeper and deeper, which is not good. Okay, let it sit. You know it's hanging down, it did go, it went like right across through here, so that's what we want. You can place them right along here. I tend to find it's a little bit harder, well, it's hard to see. And also there's like some serious nerves going on in here, at least mine seem to be pretty shallow. I don't know if it's because I've got autoimmune illness and I'm just more sensitive, but I feel like I tend to feel pinching into this area much more easily. So twist and remove, and there you go. So because that happens with me a lot, I go super slow into this area, you know, and it's, like I said, it's kind of hard to see when you're like looking like this, like some kind of weirdo. And also I don't have a lot of fat down here at all, a lot of skin to work with. And so it tends to be a little bit more difficult, but you know, getting that line is desirable. So I just go right as close as I can to that little ridge there. And by the way, I'm already starting to see and feel some plumping, some volume in through here. just from the few I've placed. And you will see that, you know, it is, you know, you do get a little bit of instant gratification. It's not like that super instant thing you see with fillers, but it's definitely there. So I'm gonna go in through there. Yeah, right there. You want to be really careful because you clench your jaw right in front of your masseter. There's a lot of shit you don't want to hit in through here. Do a little research on that, but there's a, you know, an artery, there's a lot of vasculature, there's a lot of nerve in there you don't want to hit. So you want to like feel where that notch is in you. Mine is a little further back here, so I'm being a little extra careful. I don't hit that. I've got like a super muscular jaw too, so. See it right there. There, that is like exactly where I want it to be. Okay, let it sit. Hemostasis. Sorry, my nose is all up in your face, my like big old crooked nose. All right. So obviously I'm gonna be doing the same thing on this side. Okay, I'm not seeing any blood or anything. So you twist, pull out. And whoop, see, even with that, I didn't let it stay in long enough. Heed my own advice, right? So obviously I hit a little vein there. But, you know, with threads, you don't have to worry about vascular occlusion. As I said before, you know, you go through a vein, you get into a vein, you're not going to do any, like, damage to yourself except for causing some hematoma, which, you know, we can all live with. I try to avoid that because I want people looking at me and going, who the hell hit you? So, anyway, so after we do this, it's a little loud, sorry. Trigger warning. So yeah, I may go in and do a couple more, but I do want to show you guys my lips, and I don't want this to be over long. I don't even know if this video is gonna like go through at this point. It might be too much. In fact, I think I will stop it here and just do a separate lip video. However, something to be mindful of, you just poked shit into your face, okay? So infection is a big risk. Do not, please, do not start slathering on your skincare after you've done this. Alcohol it really, really good and let it sit for a couple hours. Don't do anything. Don't put makeup on, don't put skincare on. When you have little open channels there in your face, you're creating channels inviting infection, basically, unless you're super careful. When you're at a salon or a spa, or I should say med spa, not a salon. When you're at a med spa and you get procedures like this done, like after a microneedling or whatever, and they put things on your face, those are from sterile single-use packages. They are made to be used on open skin. Whereas your shit that you have at home, like your Drunk Elephant or your Ordinary, whatever the heck it is you are using, is not made to go into the skin. So just let it be. Let it do its healing thing. Okay, you know what? I don't feel like stopping this right now. I feel like just going on. So, now it is time to... Whew, my lips are freaking numb, people. Oh my God, this is gonna be great. I'm not a huge fan of numbing cream in general, like I mentioned, but the lips are so full of nerve endings. It is like, it is a really hellish place to put threads. And honestly, the less pain, the better right now. Okay, so again, we have our thread. You don't want to go, I should say, you don't want to fall short of your vermilion border. I should say that oh my God, the Cupid's bow. Oh God, I can't think. You don't want to fall short of the Cupid's bow because that's kind of what you want to define in your lips. Yeah, I was hoping I could, like, if I had some 13s, I could go right in through there again, but I don't. So because these are 25s, you're gonna measure where you want it to end. See where that is right there. And then hook it in on the border. Okay. Follow that line. And a little. Where? Okay, you feel it right here. We're at the peak. This is what we want. I'm not gonna lie, guys, this is intense. But if you numb for long enough, if you're especially sensitive, or you're like me and you have autoimmune illness and you tend to get a lot of pain issues, like you're an overreactive, response to pain, like I happen to have when I'm feeling sick, you really want to numb up, because if you're concentrating on pain, you're not going to concentrate on like your placement, what you're doing. And the lips in particular, it's, I don't feel bad about numbing it, because A, it's so freaking painful if you don't. And B, it's not like doing cogs where you kind of need that pain. If you have too much, if you inject Lido or something like that when you're doing cogs, and you can miss the fact that you're hitting something you're not supposed to hit. And you might just kind of plow on through where you should not be plowing on through and cause nerve damage. So, if you're a medical professional, by all means, let them Lido the hell out of you. It's super difficult to know how much Lido to use, especially injectable. But even like the topical with cogs is not going to really make a difference anyway. I mean, it's like those things are intense. Okay, but okay, other side. And if you're not a professional, you're not going to really know what you're doing. You need to pay attention to your pain. So I never suggest injectable Lido unless you really have some serious knowledge, which DI warriors often do not. Okay. Whew. Yeah, baby. Hurts so good. It's actually not terrible. Okay. And all the way up to that border. Okay. That was a little hard because I was getting some resistance. I had to like readjust slightly to get it right into that border. Okay, let's sit. Hemostasis is your friend. Do do. Yeah, I'm gonna do more here. Okay, so twist, pull out, tap it so you don't stick the crap out of yourself. See this little blood flash there? I don't know if you can see that. That means you definitely need to leave it in so that hemostasis has a chance to really do its thing. Now, let's see. Awesome. I will not lie. Doing that area it can be kind of painful, but you know, let your numbing cream sit on. Get some professional numbing cream. Usually Korean stuff has got like the 10.4 or whatever lidocaine. Let it sit on for about half an hour. You can saran wrap it so it really sinks in there. It'll make a big difference. You know, it's not unbearable. And I have pain issues, and if I can handle it, you know, we all can. Okay. I happen to like the kind of like really center fullness. So I don't tend to make this area super puffy, but what I do like to do, which I'm going to do now, holy crap, I use like 10 threads. Okay. Yeah. Bracing. All right, so what we're going to do, another thing you can do is to fix your resting bitch face, if you happen to have one, is your oral commissures. Oral commissures are this. I'm going to talk funny now because it's a little bit painful and it feels kind of weird. So oral commissures are right in through here. These are what you need to lift if you have the RBF thing going on, okay? So in order to help do that, there are several ways. You can do fillers, you can do Botox, you can do all kinds of things, but really building up this area, letting the collagen get in there and doing a little bit of lift will help tremendously. I've done it. I thought I saw something on my hand. Good God. So basically, you're gonna go under the vermilion border, right into this fleshy area here, and you wanna kind of cross them. So you got one going here, one going here. You can also do it straight up to this direction. I happen to like for my own particular anatomy, it seems to work well if I do the crisscross. So, I want to under it there. A little sucker in there. Right into those oral commissures. So needle is ending right into this area right here. So what you're doing is you're building collagen into here. You're adding like even little twist threads like this will give you a tiny bit. It'll give you volume, support, structure, and then, you know, a little bit of lift as well. The more volume you add into here, you're gonna turn up these corners. It's just anatomy. It's just how it works. And then supporting those corners by adding them in through here, you get a nice base of support. This area I did not numb, the outside here. Okay, oral commissure right here. Because it doesn't really seem to need it for me anyway. Turn the bubble. Right in there. Okay, good. Sorry, I keep disappearing off camera. Okay. A little bit of bleeding, that is okay. I did not let things sit for long enough, obviously, but that's all right. So you built up that structure in there. It's really, especially over time, you know, you do this every couple of months, you're gonna definitely notice a difference. Look, see, it's upturned already. You can see the difference on each side, or at least I can, I don't know. So, same thing over here. See? And go over here, down to here, up to here. Kind of know where I start that thread. I'm like lisping. Very good, very good. Let that sit. I wish I could talk, but I really kind of can't. Much better on that side. Blood. Okay, I'm just capping, like I said, I always cap these. I have to use them, so I'm gonna stick the crap out of myself. There you go. Okay, got my little like box over here of all my sanitation and stuff. So, again, I'm gonna take our alcohol, sanitize, sanitize, sanitize. This probably doesn't bear like saying, you probably guys know this, but don't put lipstick on after you've done this, at least for like, give it several hours. By which I mean, you know, try to give it like 8 hours or so those channels really have a chance to close. You know, if you're prone to infection in particular, you don't want to be adding, you know, you're literally like inducing bacteria if you put shit like makeup on after you do this. These are open wounds. They're tiny wounds, but they're still open wounds. And since there's a channel leading in there attached to a thread, that entire thing can get infected. Okay, see? Uplift. It's amazing. Now, I'm gonna show an area right here. This is like deep fold, this deep kind of wrinkle thing. I've been dealing with it forever. And I've tried like filler on it and everything, and it's just really stubborn. Part of it needs to be like subsidized from like, because sometimes when you get these really deep wrinkles, they are literally attaching to your muscle because they're just that ingrained. It'll happen like that. It just adheres. It's called an adhesion. And you can get that with facial folds and things like that. What these will do is it'll help to kind of cut through that adhesion a little bit so you don't have that, it's not sticking as much. And so threads will help you with this. Right there. So yeah, if you see, I went right through it. That'll help to cause a little bit volume and collagen production and kind of cut through that adhesion a little bit, which hopefully it'll go away eventually. It might not. If it doesn't, I'll freaking live with it, but I'm kind of trying to see if it'll do any good. This video is getting really long. So I hope you guys are enjoying this. I hope I'm giving you some decent information. The reason I'm not doing my lower lip is because I am happy with the way it looks right now. I've done them down here before. This time I'm just skipping it because I don't think I need to. It's my top lip my top lip has the issue. Also, another thing to note, threads are really excellent for the eye area. It's like still a little boozing from like weeks ago. My boozing like lasts forever. I tend to have a lot of hollowing in through here because of fat loss and age and things like that. So take this sucker out. As a result, many of us want to go to filler right away, which I really kind of wouldn't recommend. It's not a permanent solution. It's really easy to screw up. I mean, if anything, you can, I would recommend some mesotherapy in that area where you're going really shallow with some PDRN. PDRN is basically it's salmon jizz, to be really frank about it. But what that does is helps to build collagen without adding a lot of volume, because what happens is when you're putting hyaluronic acid in this area, hyaluronic acid is hydrophilic. That's what it does. It draws water. So you're gonna get all that extra swelling. Sometimes it's really easy to overfill in that area, especially for DIY. And people tend to get overzealous and wanna really like shove it all in there. It's really easy to overdo it. And then you're really unhappy because you get like those little bubbly bags. It tends to migrate really easily because it's a very dynamic area. So with threads, you can not only help to volumize this area, you also can help get rid of crow's feet, which, when I go like that, I have them. I need to probably tox that area, but trust me, it was, it's much better than it was. I'd say like, I don't know, how long have I been doing this? Probably, I don't know, a year. When I first started doing it, I had very noticeable static lines. Now I only have dynamic lines. And that, it's a work in progress. It will eventually get better. Okay, I'm gonna clean this off again. And so I'm gonna finish up on this side, but this video is getting really long, so I'm gonna stop. I will do a video with my eyes. I'm gonna do a little bit of a brow lift video as well. I'm gonna do all the things, but this is getting to be really long. So to recap, adding volume, collagen production, elastin, and adding some tightness within this area, which is starting to get like a pre-jowl effect. I may get a little gung-ho and put a couple extra in there just to really boost it up and let it have a really good collagen boost. Another thing to note is if you have a professional grade RF device at home, don't use them on your threads, because RF devices will really accelerate the degradation of your threads. They will, and they won't get a chance to do what they're supposed to do. So now that I've done this, I'm not going to be doing any RF like right in through here, because I don't want to melt all my hard work off, I will give them at least a couple of months to really kind of integrate into my skin, and then I can start doing the RF again. You want them to start working, and they'll start producing collagen in around 12 weeks. So that's when you can go back in with your RF and like touch areas up. I'll just do the rest of my face with it, which is fine. But it's actually been really good tightening since it's tightened up to quite a degree. Now I want to go in there with the threads and build up that volume and add some more structure and tightening. Okay, so that is it. I'm going to finish up my stuff here. I hope this was helpful to you, and I will be doing more of these in the future. All right, happy DIYing, guys.